So once again, my dear students, welcome to my YouTube site. Today we are going to discuss about UVR dosage calculation, part 2. This is lecture 4 and the final lecture in UVR. In previous lectures, that is in UVR lecture 1, we had seen about electromagnetic spectrum and how we can classify differentiate UV rays in the electromagnetic spectrum. Lecture 2 we had seen about the productions. Combining lecture 1 and lecture 2, we had seen productions of therapeutic productions of UVR. Lecture 3 we had seen about UVR dosage calculation, how minimal erythemal dosage is being calculated, and this is the last lecture wherein we will discuss of this is the last lecture for dosage calculation, and lecture 5 will be the final lecture of this UVR, which will have therapeutic and physiological effects of UVR. So now before going on towards the how we can produce or how we can uh, you know progress with UVR, I would like to have a quick revision in terms of UVR. So yes, before we progress ahead with our today's lecture, that is UVR dosage calculation part 2, what we have learned in last lecture, we have learned that about minimal erythemal dosage. Yes, minimal erythemal dosage, then latent period of erythema dosages, that is E1, E2, E3, E4. Yes. Apart from this, we have also learned types of skin. Yes. Based on these types of skin, your erythema generation uh, is dependent. So there are total 6 types of skins, and apart from this, minimal erythemal dosage test procedure. Yes. So where we can do this test procedure? Forearm, abdomen, and medial aspect of thigh or arm. So these are the things which we have discussed in precise manner and in detail in our lecture 3. Yes, there are certain confusions which I have come across through my students, that some textbooks say that your minimal erythemal dosage is different. You cannot term minimal erythemal dosage as even. You cannot term even as minimal erythemal dosage. Certain textbooks, I would not like to mention the names of those textbooks, but certain textbooks have mentioned that the before going on towards the dosage of UVR, the average output of the lamp is supposed to be taken out, and that average output of lamp is nothing but minimal erythemal dosage. I strongly disagree with this point, and as per the standard textbooks of electrotherapy, that is Electrotherapy Explained through Law and Reed, yes, uh, it has clearly said that E1 is equivalent to minimal erythemal dosage. We will discuss this in our chapter. I will share you the screenshots of that particular textbook written language. Apart from this, one second doubt is that you cannot uh, change the distance of lamp once you have fixed minimal erythemal dosage. That is also a wrong concept. If you want to change the distance of lamp, there is a different calculation which we will also discuss today. That how, if you change the distance of lamp, then what you are supposed to do, and again how you are supposed to calculate the dosage. So these two important things we are going to discuss. So this lecture is as important as our lecture 3. So yes, my dear students, we are now going for the progression of UVR dosages. We have learned minimal erythemal dosage. Now, certain things which are very important in your practical questions. Yes, and how to progress. Yes, because it is not fixed that, for example, if your even or minimal erythemal dosage was 1 minute, we will keep on this 1 minute throughout the treatment of UVR. We need to progress. Yes. So when to progress and how we can calculate, this is the thing which we are going to discuss in this uh, lecture. Clear? So the quantity of UVR energy. Yes. So how does this minimal erythemal dosage depends, or how your skin reacts to UVR? So first thing is, it reacts based on the output of lamp. So different outputs of lamp are varied because of its make. Different companies type, whether you are using sun alpine lamps, whether you are using chromium lamps, or whether you are using your fluorescent tubes. Okay. Third thing is aging. Yes, aging means, as we all know that, tridamite forms as we start using the lamp. Okay, as we start using the lamp, the tridamite forms. So the UVR output gradually decreases. So by the time of 1000 hours, the UVR output decreases. So here is my question, and here is my answer to the question also, that if people say that you need to find out the average output of the lamp, this is not possible. Why this is not possible? First thing, you are using different types of lamp. You are using different companies. So for example, if you are fixed that X company has an average output of time as 7 minutes or 5 minutes, clear, and this is the type, okay, understood, accepted. But my dear students, this lamp will gradually, the output of UVR will gradually decrease in this lamp. Yes, why? Because of aging. This is the basic factor. So if the output gradually decreases, how we can have an average output? Okay, so that is not possible. First thing. Second thing, how we can not have your average output is the distance between the lamp and the skin. So for example, for one patient I'm keeping at 50 centimeters, and for another patient I'm keeping at 70 centimeters. Yes, so the distance really matters. The distance really matters. Clear? So at 50 centimeters the average output is 5 minutes, and at 70 centimeters the average output can be 7 minutes, or can be 4 minutes also. So you cannot justify this. Okay. Again, the third thing is angle at which the radiation falls. So it is very important that you place your lamp at 90 degrees. That is at the perpendicular while you are treating. And the very, very, very important is sensitivity of the skin. So we have discussed in our previous lecture, there are 6 types of sins. And based on this skin types, every skin reacts. So here I will like to put a note. Yes, and this is not me who is saying that, this is very much clearly explained in electrotherapy law and read textbook, stating it, the average output of the lamp can be justified because of following parameters. Which are these parameters? First thing is aging of the lamp. So tridamide. Second thing is distance between the lamp and the skin. And third thing is different skin types. So my dear students, please make sure that you have idea about this, because this is very important, and even certain people who are not sure about the basics of this UVR testing, they may ask you, but this is the clear example and this is the clear answer to this. We would move forward so that, you know, yes. So here I am saying, see, you see degree of erythema E1, E2, E3 and E4. These are clearly mentioned in electrotherapy explained law and read textbook. We have discussed this latent period 6 to 12 hours, 6 hours, 3 hours, less than 2 hours. Yes, we have discussed the colors also: pink, definite pink red, very red, angry red. So as you move on, as you increase the intensity, the color changes from pink to red, and even your latent period decreases from 6 hours to 2 hours. But your approximate duration for which the erythema may stand, which is somewhere around 24 hours, decreases, it increases to 1 week. Yes, and what are the skin types? We have discussed in lecture 3. Here you can see E1 relation to E1 is nothing but into 1. This itself says that it is minimal erythemal dosage into 2.5 into 5 and into 10. We are discussing it next in the coming slides. Okay. Apart from this, yes, this is very important. So I'm focusing this, yes, because I have come across to n numbers of questions. I have got messages on my phone that, so please let us know the valid reference that why E1 is stated as minimal erythemal dosage. Yes, 4 grades of erythema are commonly used: E1, E2, E3, and E4. Their descriptions are based upon the following: duration of latent period, intensity of erythema, yes, how red it is, duration of erythema in hours, how long it starts, the severity of irritation, presence of edema, extent of desquamation. So there are 4 grades of erythema, and these grades of erythema are based on what parameters? First, latent period; second, intensity; third, duration of erythema; fourth, severity of irritation; fifth, presence of edema; and second, the type of desquamation it causes. And moving on, next, this is what I'm repeatedly saying: the grading of skin reaction is subjective judgment that applies to the individual patient in the test condition used. So it is a subjective, it is not an objective judgment. It is very subjective. Clear? It is very subjective, and referring to the even of the lamp is meaningless. See, this is what I am discussing. Referring to the even of the lamp is meaningless. You cannot find even of the lamp. It is impossible to find the even of the lamp. Why? Because of the 3 parameters. First thing is aging. Okay, as the lamp ages, it increases. As the lamp is being used, the output of the lamp reduces. Second is the distance between the lamp and the skin, and the third one is the skin type. So this is E1 lamp is meaningless. E1 indicates the observed erythemal dosage on a response of a patient for a particular lamp at a given distance. for a specified time of exposure. This in terms even and minimal erythemal dosage response to the defined dose. Clear? So minimal erythemal dosage, yes, first grade of erythema is also known as minimal erythemal dosage. It is also known as minimal perceptible dosage, and it is also known as minimal. It is also known as, yes. So minimal erythemal dosage is clearly said that this minimal erythemal dosage, or E1, is also known as minimal erythemal dosage, which is widely used. Minimal perceptible dose or minimal phototoxic dose, MPE, minimal perceptible erythema. So E1 can be MED, E1 can be MPD, or E1 can be MPE, difference. But again, I would say this grading of the skin reaction is a subjective judgment that applies to the individual patient, and finding E1 of the lamp is meaningless because it is a response of the patient's skin first to the particular lab at a given distance. So these three factors influence minimal erythemal dosage. So it is very, very, very important that minimal erythemal dosage is supposed to be found out for every patient, for every lamp, and for every distance. Clear? So here the takeaway home message is, even of the lamp is meaningless. Yes, we need to find MED for every patient, every lamp, whether you are using the same lamp again and again and every distance, irrespective. Clear? So this is what you are supposed to take. Clear from this? Now we would move on. It is very simple. Okay. So we have found out even. So for example, if your minimal erythemal dosage MED is 60 seconds, yes, you can either take the dosages in 60 seconds or you can convert into 1 minute. For example, I have converted into 1 minute. So what will be my E2? E2 is nothing but 2.5 into E1, which is equal to 2.5 into 1, which is equal to 2.5 minutes. Clear? And if I wanted to calculate in seconds, I would have 2.5, so 60 seconds. Okay. Third one is E3. So for example, what is E3? Same, if your minimal erythemal dosage is 1 minute, so E3 will be 5 into E1. Yes. So what will be your E3? 5 into 1, which is equal to 5 minutes. And what will be my E4? E4 is nothing but 10 into E1, which is equal to 10 into 1, which is equal to 10 minutes. So for example, you have calculated E1 of one patient at 50 centimeters, even of one patient at 50 centimeters, right? With one lamp, your minimal erythemal dosage comes to your 60 seconds or 1 minute. So if you want to give E2 dosage, what you will do, you will multiply it with 2.5. If you want to give it with E3, you will multiply it with 5. And if you want to give it with if you want to give E4 dosage, you will multiply it with 10. Clear? So this is how we calculate your minimal your dosage progressions E2, E3 and E4 when the distance and the patient remains same. Okay, when the distance of the lamp and the patient remains same. Okay, so coming on, going towards this, so this is the example I've taken it with 1 minute. Now I'm showing you with the another example, that is if I've taken with 30 seconds. So calculate E3 dosage. So E1 is 30 seconds. What was E3? 5 into E1. So 5 into 30 is 150 seconds. Yes. So being precise, if I want to convert into minutes, so 2 minutes is equal to 120 seconds. Yes. So this will be 2.3 minutes. Clear? Now, if I want to change the distance, if I want to change the distance, what I am supposed to do? I am supposed to find out new dosage by old dosage into new distance square upon old distance square. So for example, as I mentioned, my E1 was 1 minute at 50 centimeters. So now new dosage barabar, will be, old dosage was 1 and now I want to change my distance at 60 centimeters. So 60 square, 60 into 60 centimeters divided by 50 into 50. Clear? Okay. So my new dosage will be 1.44 minutes. Okay. At what? At 60 centimeters. Clear? So if my old dosage at 50 centimeters was 1 minute, then my new dosage, okay, then my new dosage at 60 centimeters will be 1.44 minutes. So please understand, this is a very simple equation. Yes, and you need to calculate it based on different types of. So if you are calculating, yes, the same thing in seconds, you are going to put the answer in seconds. Okay, if you are calculating in minutes, you'll put it in minutes. Clear? Okay. Yes. Now that was if the distance changes. Now if I'm not changing the distance, if I'm not changing the distance, but I need to progress, like unlike your IFT or any other electrotherapy modalities, you cannot increase the intensity. Yes, if the patient is not feeling, you are increasing the intensity in other types of currents. No, here you need to gradually progress. Gradually progress. So basically, we have seen that we are not repeating the doses until and unless the first erythema caused by first treatment is subsided. Clear? So an exposure to UVR should not be repeated until erythema is caused by previous dose has faded. Clear? This is one more important thing. So after that, there will be thickening of epidermis. Clear? And there is now necessary to increase. So how we will increase? So if you are repeating the even dosage, you will add 25%. If you are repeating E2, you will add 50%. If you are repeating E3, you will add 75%. And if you are repeating E4, you will add 100%. So for example, you had given E4 dosage. first session of UVR, E4 dosage was given, which was of 10 minutes. Okay, clear. So now, according to our first norm, UVR dosage should not be repeated until the erythema is subsided. Now, this generally erythema subsides by 15 days. So, second session of UVR will always be after 10 to 15 days, and in that session, progression of E4 dosage will be as follow. How? 100% of previous dose. So this means 10 minutes plus 10 minutes. So now for second session, the dosage will be of 20 minutes. My dear students, please understand this. Clear? So if the first session of UVR was, or if UVR E4 dosage was given, which was 10 minutes at a particular distance, and with the same patient, the two and with the same lamp also, the second session of UVR will always follow after 10-15 days. Why? Because that is the duration of erythema which is going to last. So once the erythema will subside, we will give E2 dosage, right? Generally after 10-15 days, and that will be of 100% of previous dosage. That means 10 minutes plus 10 minutes, which is equal to 20 minutes. Clear? We'll see another example. Yes. So for example, if E1 was 30 seconds, now find the progression 2 of E1. Yes. If E1 is 30 seconds, yes. So E1 kya tha? 25%. E2 was 50%, E3 was 75%, and E4 was 100%. So day 1 progression will be E1 plus 25% of E1. That is fourth part, 30 plus 75%. So that is 37.5 seconds. Now second dosage. So we will take this preceding dose as our main reference. So 25% of 37.5 plus 37.5 seconds. Yes, 37.5 and 37.5, 25%. So that is 46.9 seconds. So that is somewhere around 47 seconds. So you have seen that as we progress with the dosages, the previous dose we are supposed to take in that. Clear? So for first it was 30 seconds, then progression of day 1 will be 30 seconds plus 25% of 30 seconds, which will be somewhere around 37.5 seconds. Day 2 will be 37.5 seconds plus 25% of 37.5 seconds. Now if I want to move on day 3, yes, so day 3, yes, day 3 will be nothing but, just wait a minute, day 3 progression will be nothing but day 3 progression, day 3 progression of E1 dosage will be 47 seconds plus 47 divided by 4, which is equal to 25%. So that is 47 seconds plus 11.75, which is equal to 47 plus 11.75, which is equal to 58.75 seconds. Clear? Understood? Yes. Similarly, now if I want to go for day 4 progression, what will I do? 25, 58.75 seconds plus 25 percentage of 58.75 seconds. So gradually we will go on with this kinds of dosages. So please make sure that you have understood the dosage progression. So basically selection of dosage, an E1 is given to generally total body area, E2 may be given up to 20%, E3 may be given up to 25%, 25 centimeters square, and E4 may be given to only an area where it is necessary of the treatment. Okay, where what can be done, how we are supposed to give, why E1 is given daily, because the erythema subsides. E2 and on alternate basis, E3 generally twice in a week, and E4 may be given once in a week or once or a fortnight. So that is 10 to 15 days. Clear? But this is not applicable when treating a non-skin area such as pressure areas or ulcers, or dosage may be given as daily. There is no erythema or reaction provided. So take home message in this slide is only in only in skin condition treatment you are calculating dosage based on erythema. In the case of wounds or ulcer, all the dosages can be given daily because there is no erythema in that. Okay, so please make sure you have understood this. E1 can be given daily, E2 on alternate basis, E3 generally twice in a week, E4 generally once in a week or probably every fortnight, that is 15 days, so on an average every 10 to 15 days. And if you are treating non-skin areas like pressure areas or ulcers, all the dosages can be given daily as there is no erythemal reaction. Okay, clear about this? So with this we have completed our uh, dosage calculation and progression. So what we have learned in this lecture, in this lecture in this lecture the take home message is: first one, E1 of lamp is meaningless. Why? Because E1 is subjective calculation and is dependent on output of the lamp, distance between the skin and the lamp, yes, and type of skin. Second point is E1 is also known as MED, minimal erythema dosage, MPD, and MPE. Here, okay. Then what we have taken, E2 dosage progression if the distance and the patient remains same. So that is E2 is equal to 2.5 into E1, E3 is equal to 5 into E1, and E4 is equal to 10 into E1. If you change the distance, if you change the distance of the lamp, then formula is there for dosage calculation, which is new dosage is equal to old dosage into new distance square upon old distance square. Fifth one is dosage progression. Yes, if you are calculating the same dosage, then E1 is 25% of the previous dosage, E2 is 50% of the previous dosage, E3 is 75% of the previous dosage, and E4 is 100% of the previous dosage of E4. Then E1 can be given daily, E2 can be given twice in a alternate days, E3 can in a week, uh, E3 can be given twice in a week, and E4 can be given almost once in a week or probably once in a fortnight. So that is somewhere around after 10 to 15 days. And the sixth point for the take home message is all these dosage parameters are for skin related. Yes, for non skin related disease like wound or pressure ulcers, all the dosages can be given daily because there is no erythema to be calculated. Okay, so this is my take home message in this lecture. Please, I would prefer you to watch this video in reference to our lecture 3 video. Okay, because if you have any doubts, you need to see the first video and then the second video so that your fundamentals are clear. Apart from that, as usual, I will end up with the happy face. And if you have any doubts, please ask me. Please feel free to ask me. Yes, so that we have a very easy and understanding concepts of UVL. Thank you. Thank you.